So now I would like to introduce Marcus Grindstaff. He's the COO of Care Innovations. This is a company that connects the care continuum to homes with its remote patient monitoring service called Health Harmony. And so Marcus, welcome, and we look forward to hearing more about Health Harmony.
Great, thank you.
Thank you.
So I should have brought a virtual reality headset. Videos of people using VR headsets are fantastic, but I didn't. We're going to talk about a couple of innovations in the remote care space today. By way of introduction, I'm the Chief Operating Officer of Care Innovations. Care Innovations is an Intel-backed company. Our express purpose is to move more care out of the biopsychosocial jail cell, which is something I just learned about, and into the home and into the community. Intel's in this game because it's the future of healthcare, with the risk models transferring, which Brennan talked about, full capitation, in some cases reimbursement, the acute care dilemma. This is the future of healthcare, and Intel is a strong supporter of innovations such as remote care solutions. I'm going to talk about a couple of innovations today, and then a very pragmatic consideration as you start your journey into delivering more remote care, more care into the home and community. So let's start with the couple of innovations. We are releasing something that's an activities of daily living monitoring system for the home. And what's important about this? For about the last 10 years, we've collected activities of daily living data in senior living communities, in assisted living, in independent living, and in memory care. And in those communities, it's very well understood in that small, self-contained environment that things like total activity, things like the number of times a bathroom is used, things like the amount of socialization are absolutely related to someone's health status, and further, to their likelihood to be able to remain at that level of care. So for over a decade, we've been collecting data in that space. We have 7 billion data points from people in those communities. Using the Intel Trusted Analytics platform, we're able to take that and create predictive models. And this is where we believe this whole industry is headed. So we can create predictive models in a senior living community that predict who's likely to move out and move up into a higher level of care. That way, we can intervene earlier. So that's something we're actually doing today. And again, we think that becomes pervasive as all this data is collected, as everything we're hearing about on stage, more and more data is collected, transforming that into predictive models that allow us to identify who needs to be intervened with and what level of intervention. We're moving that from the sort of captive audience of a senior living community. It's a little easier to start in the senior living community. We're moving that into the home. We've all probably been there with mom or dad, and you go home and you see that they're just not as active as they used to be, right? That's directly correlated to health status, and again, we have the data to prove that. We're not the only ones. A lot of people are moving along in this space. So we think that predictive capability is super, super important. That's a technology innovation. Let me talk about another innovation. At the end of the day, healthcare is partially a people service, like we just talked about, if not mostly. The other innovation that I want to talk about is professional education for people who are delivering care remotely. At the end of the day, a lot of our chronic disease burden is behavior-driven. And we now have a suite of classes that allow for continuing education credit specifically for behavior change using remote care technology. So we can't just take technology and put it out there and expect something to happen. We have to innovate on the people side of this process as well. So as you think about, here's the pragmatic piece, as you think about going down this journey to delivering more care into the home, look for balancing both the technology innovation, where's the technology going, with the rest of the innovation. This is the people and processes. It's the logistics and asset management. It's the enrollment and recruiting. It's the clinical management of those patients which are in the home or the residents in the senior living community. Look for balancing both of those to have a truly successful program. And that's my few minutes.